Spinal stenosis is the leading cause of spine surgery for patients over the age of 65. 20 to 25% of patients over the age of 65 will have evidence of spinal stenosis on MRI, but not all those patients are symptomatic. Only 5 to 8% of patients over the age of 65 will have symptomatic spinal stenosis. There's 3 different kinds of spinal stenosis: central canal, lateral recess, and foraminal stenosis. Central canal stenosis is right here. This is where the center of the spine, where the nerves flow through the spinal fluid, is narrowed. The lateral recess is on the edge of the central canal before the nerve root exits. And then foraminal stenosis is right here. This is where the foramen, or hole that the nerve exits from the spine, is narrowed. So these are some MRI images to give you an idea of what we're looking for whenever we're looking at your MRI for stenosis. So the top here is different grades or severities of central canal stenosis. So here in the center of the spine, this white stuff is the CSF, or fluid, that your nerves are bathed in, and the little tiny dots are the nerves themselves. So you can see as you go along from 0, 1, 2, and 3, that fluid is getting less and less, and those nerves are more clumped together. So down below me here, this is grades of lateral recess stenosis. So again, the lateral recess is this area right here on the edge where the nerves are about to come out of the spine. And you can see as you go along, that area is getting more narrowed. And the last images down here are foraminal stenosis. So this white stuff right here that the arrow is pointing at is fluid around the nerve as it's exiting the spine. The dark spot is the nerve itself. And as you go along with these from grade 0 to grade 3, there's less and less fluid or space around the nerve because that hole is smaller and smaller. Your lumbar spine or low back is by far the most common place to have spinal stenosis, followed by your neck or cervical spine, and your mid-back or thoracic spine is the least common. With lumbar stenosis, you typically have back pain. Sometimes it shoots down the leg. It can be associated with numbness or tingling in the leg, or a feeling of heaviness or even weakness in the leg. As it progresses, you can develop something called neurogenic claudication, which is where when you try to stand up and walk for a period of time, the legs feel really heavy and you have a lot of pain in your back, which is typically relieved fairly quickly by sitting down. If it continues to advance, you can actually develop something called cauda equina syndrome, which is where you can lose control of your bowels and your bladder, but that's in very severe cases. Cervical stenosis presents with similar symptoms. There's neck pain. Sometimes that pain can shoot into the arms. It can be associated with numbness or tingling, or even weakness with fine dexterity movements of the hands. And if it becomes severe, you can develop issues with balance or gait. So tomorrow I'll make a video going over the causes of lumbar stenosis and the most common treatments.